Hello everyone, welcome to Clinical Mathematical series. Today we are going to discuss Guaiacum officinale. So understanding of Guaiacum officinale. So this is one of the remedy you can think in acute rheumatism with lot of stiffness and immobility and the patient feels that he must stretch. So whenever patient comes with lot of joint pains and patient says, doctor ना मेरा joints are बहुत stiff, I cannot even move, इतना stiffness, इतना contraction is there, I cannot even move, and the patient feels that if I stretch only, I feel better. Even with immobility and stiffness, they feel they must stretch. That is the key indication of Guaiacum officinalis. And interestingly, this remedy has action on fibrous tissues with arthritic diathesis. It is one of the remedy in arthritic diathesis and has main action on fibrous tissues. And these rheumatic joint pains are more painful from heat or from warmth. Along with that, the other remedies you can think of is lacanum, ledum, and pulsatilla. In Guaiacum officinalis, the pains of joint pains are amel by cool. Even with ice application or ice cold application, you can think of Guaiacum officinalis. And here you see the joint pains are better by cold applications and external pressure. And this remedy has more action with lot of stiffness along with cervical spondylitis, which aggravates a damp weather aggravation. So now we are in a season that is monsoon season with this damp weather aggravation or this wet weather or this rainy weather. The patient complains of lot of stiffness with cervical spondylosis. Think of Guaiacum officinalis. And another interesting keynote of Guaiacum officinalis is all the stomach symptoms are better after eating apple. And these Guaiacum officinalis patients always craves for apple and with stomach symptoms, and they feel after eating this apple their stomach symptoms feel very much relief or amel, and better by yawning and stretching. Worse from motion, heat, cold, and wet damp weather aggravation you can see in this remedy. So here the picture is very clear that Guaiacum officinalis is in between the remedies of rustoxicodendron and bryonia. both both in cases of arthritic lancelations followed by lot of contraction of the limbs, so there is lot of stretching or you can see lot of immobility in this remedy. And one of the important remedy to prescribe Guaiacum officinalis is with recurrent tonsillitis along with rheumatism. Think of Guaiacum officinalis. The other remedy you can think of in this condition is streptococcinum. And if a patient complains that doctor na in past or previous 6 months or 7 months I suffered with tonsillitis, then after these tonsillitis is gone, then I developed all the joint pains, my body is aching, I cannot even walk, my legs are so much of pain, so much of joint affections are there, then think of Guaiacum officinalis. And other remedy also, that is streptococcinum. In sore throats with joint affection, this remedy has very sphere of action. And interestingly, in subacute and chronic ovaritis in rheumatic women. So, in women, coming to the female sphere of action, the patient suffers with lot of chronic ovaritis or subacute ovaritis or any female disorders along with rheumatic pain, along with joint pains. This remedy has a prominent action. And here, with PCOD, with rheumatism, amenorrhea with rheumatism, this is one of the remedy. And all the Guaiacum officinale patient tells the pain is the characteristic of pain is stitching pains. Some needle like pricking pain you can see in this remedy. That is the characteristic pain in this remedy is Guaiacum officinalis. And other important side of Guaiacum officinalis is in cases of infective arthritis, where we have tried remedies like Cilicia, Merck, but not helping. Think of this remedy. So in cases of infective arthritis, there is lot of pus or suppuration you can see with that. with arthritis or that infective arthritis, think of these remedies, silicia and murk. And when in cases where there is no characteristic symptoms, so if a patient comes with joint pains and he says only pain, doctor, there is lot of pain, but I cannot say when this pain is more, when this pain is less, and what type of characteristic of this pain, or you cannot find any concomitants, but patient complains of lot of pain, intolerable joint pains, and there is no characteristic of symptoms, and you have prescribed rustox, pulsatilla, lacanum, bryonia, but nothing is helping. Think of this remedy, guaiacum officinalis, where there is no characteristic of symptoms, where there is no modalities, patients just tell pain, pain, joint affection pains, think of guaiacum. And in membranous dysmenorrhea, along with guaiacum, there are other three remedies which have prominent action is borax, ustilago, and viburnum. So to confirm borax, you need to confirm about the dread of downward motion in a patient. That is borax or any skin complaints you can think of. Ustilago is a fungal remedy where there is lot of sexual desire you can see in this remedy. Along with hair fall, viburnum with past history of abortions you can think of. And in one-sided backache with lot of stiffness. So guacam officinalis have the backache of only on one-sided, left-sided or right-sided, more of left-sided, and only the one-sided backache with lot of stiffness, and pain is such a violent with motion aggravation and amel by rest. It has a prominent action in cervical spondylosis as well. And another key informatory of Guaiacum officinalis is summer colic. Whenever the heat or the summer weather starts, the patient complains of lot of stomach pain, abdomen pain, gastric pain, gastritis. Only especially in the summer. That is summer colic. Always think of Guaiacum officinalis. And here you see, along with lot of depression and sadness, the pathological link is with tuberculosis. Mind, depression, sadness with tuberculosis, Guaiacum officinalis. And this Guaiacum officinalis has a mind state like Helleborus. They staring at thoughtless. They stare at one thing. They are very much thoughtless, like Helleborus like state. You can think in Guaiacum officinalis. And this remedy is very closely related to causticum, sulfur, along with that tuberculinum. And in the first slide, I already discussed in cases of acute rheumatism, right? So here you can think in cases of chronic rheumatism is causticum. In cases of acute rheumatism is guaiacum officinalis. This comes very close with lot of stiffness, same. And in cases of pleurodenema with tuberculosis, think of Guaiacum officinalis. And the key confirmatory, the craves for apple. The other remedies are antium tot, delirium, aloes, and sulfur. And this remedy is aversion to milk. But interestingly, there is the remedy that is rustox, the desires for milk, especially the cold milk. So here you can differentiate the guaiacum and rustox in joint affections. If a patient comes, ask, do you like milk? Patient says no, can be guaiacum with lot of stiffness. And patient desires to have cold milk with lot of stiffness, can be rustox. In cases of carpal tunnel syndrome, when the wrist affections, that is especially the left sided, with lot of stiffness, with lot of burning pain, and amel by applying ice or ice cold water, think of guacam. See here, even with lot of stiffness, of lot of contraction, or lot of immobility in guacam officinalis, the person still feel to have stretch, either the wrist or the joint, despite of lot of pain you can see in this remedy. So this is guacam officinalis. Like, share, and subscribe our channel. We are coming with lot of clinical indicated clinical remedies and their application. Do subscribe. Thank you.